Today, we're gonna try something different. I've got a couple of scenes from Marvel's Doctor Strange queued up, and I'll be sharing my reactions straight off the cuff. If you enjoy this type of content, be sure to let me know in the comment section down below. So right away here, so this is something that's pretty accurate. He's washing his hands at the scrub sink, and then he's gonna use, in this case, a disposable towel to dry his hands. We still wash our hands this way in the operating room, or at least some of us. And now there is a move towards using alcohol-based soaps to clean our hands, because this is gonna give us better kill of the bacteria, and it's gonna prepare our hands better for surgery. So not everybody is going to wash their hands this way. A lot more of the old school surgeons will still do that, but people who have been trained more recently will tend to use the alcohol preps more frequently than they will soap and water, just as he's doing here. Oh, okay, now that's a problem. He has his gown, which he is putting on, and somebody is actually gowning him, which is what we normally do, because as you have washed your hands from your hand, tip of your fingers down to your elbow are what we would call sterile. A sterile field is a sterile surface or area on which or into which we place sterile equipment that is considered free of organisms. They used to use the word in the definition. God damn it. Put simply, sterile means free of germs.
Thanks, Doc.
Thanks, Doc.
Thanks, Doc.
You can't touch anything that is not clean or not sterile with those surfaces. So he'll lift up the gown, put his arms in, and then an assistant will come behind him and put the gown on. He won't put his hands through the opening yet, because the nurse is going to generally glove him. In some situations, people will glove themselves, but they won't do it in the way that he's demonstrated here. The problem that I have with this part of the scene is that after he's washed his hands, so his hands are clean, and he's put on the sterile gown, he doesn't have his gloves on yet, and yet he touches his mask, because his face is not masked yet. He touches his mask with his hands and puts the mask on. So the mask is basically a dirty item. When we're in the operating room and we're cleaning ourselves, basically in between your nipples and your waist, all of that is the sterile area, but anything that's above your nipple line or below your waist is dirty. And so his mask, which is on his face, is dirty. And he's now, with his clean, sterile hands, touched his mask and put it onto his face. And then immediately thereafter, he goes to glove himself with sterile gloves, but now dirty hands, and then he proceeds with the case. So this is a problem. And you know, this is something that maybe they change the order in which they film this, but this would technically be a sterile break, and his hands would now be dirty, and this in this scene, we see that now he has started operating, and he's operating on the spine. He's tapping his foot to the music, and then he's dancing to the music. And it's very common for surgeons to play music in the operating room. Depending on who is in the operating room and who has the authority in the operating room, this will kind of determine who gets to play the music. In most operating rooms, it's generally going to be the anesthesia doctor who is playing the music, and that's just because they have access to the stereo or to the iPod or to their phone or whatever it may be. But in a lot of ORs, the surgeon will be the one that's in charge of the music. And there are actually studies that look at what is the effect of the music that is being played in the operating room on the surgeon's ability to operate. And these studies have basically shown that they operate the best or the most effectively when they enjoy the music that is being played.
I'll say I find it remarkable how much having music helps me actually with
the act of performance.
Usually they'll ask around the room to see what the taste of the people in the room is, so that they know what to play, but oftentimes they'll just play whatever they want.
By playing AC/DC hits like TNT and Highway to Hell.
Yeah.
So far, I'm gonna get my phone so I can maybe take some notes, but this is great.
Challenge round, Billy. Oh, come on, Billy, you gotta be messing with me.
No, doctor.
Feels so good. Chuck Mangione, 1977. Honestly, Billy, you said this one would be hard.
Ha! It's 1978.
No, Billy, while Feels So Good may have charted in 1978, the album was released in December of 1977.
No.
So we will do things like this. During surgery, we need to be focused on what we are doing. But there are some things that we do in during the surgical procedure that are kind of like rote, or that we know by rote, or that they're kind of like robotic motions. We're just kind of doing something, and we've done it so many times that we don't need to dedicate 1000% of our attention on it. At times like this, sometimes people will be having some kind of conversation. Oh, did you watch the game last night? Or what did you think about this movie? Or whatever. In this particular case, here we have the anesthetist is picking random songs, playing them, and then Dr. Strange is trying to figure out what the song was, when it was performed, who it was performed by, and where it was done. So this kind of thing does happen in the OR quite frequently, where, when we're not having to devote all of our attention to the procedure at hand.
1977.
No, Wikipedia says it's a
Check again.
Where do you store all this useless information?
Useless? The man charted a top 10 hit with a flugelhorn. Status, Billy?
1977.
Oh, please. I hate you.
Boom! Feels so good, doesn't it?
As surgeons, we are generally type A personalities, and so we like to be good at what we do, and we are very competitive. We like to win. So here, he is being quizzed by the anesthetist about this song. The anesthetist challenges him on a point, and he says, no, look it up in Wikipedia.
Check again.
And of course he's right, and then boom, yeah. He does a little victory dance there because, we are a bit competitive.
Oh, I got this, Stephen. You've done your bit. Go ahead, we'll close up.
Now, fortunately, Dr. Strange is in a facility where he has either residents or fellows or other doctors that are working with him during his procedure. Usually in the operating room, we are going to have an established hierarchy of people that have differing levels of responsibility. So you'll have the surgeon who's at the top of the ladder, and then you'll have the first assist. And that's the person who is going to provide the most assistance or the most complicated tasks that the surgeon needs help with. They're going to help them with those tasks. Depending on what type of facility you're in, that could be another surgeon, or it could be another physician, which is usually a family physician, or it could also be a PA or a physician's assistant. If you are in a teaching hospital, there will be additional bodies around, and you may have a fellow, which is a surgeon who has graduated his surgical program, but then he's gone to another institution to learn additional techniques.
I've been busy balancing schoolwork and extracurriculars and finding ways to apply the knowledge I gained last summer while interning for Dahlia Lithwick at Slate.
Wow.
And then below the fellow, you'll have the residents. And you can have the senior resident, which is a resident towards the end of his training program, or you can have a junior resident, which is a resident in that particular field, but towards the start of his training program. Below that, you'll have interns, which are usually residents that come from another service. So in the case of orthopedics, an intern in our service would be somebody from the general surgery program that is coming to spend some time with us to learn orthopedic surgery techniques. Basically, they're physicians that are from another program, not your own specialty. And below that, then you'll have medical students and observers, and then of course you have the nurses. So that's the hierarchy that we have in the operating room. And so you'll usually have the surgeon and then their first assist and then everybody else. Quite frequently, The lead surgeon will be the one who's performing the most difficult part of the operation. But often they will have the more junior staff or the residents or the fellows do the surgical approach, which means cutting the skin and taking the surgical field down to where we're going to be doing the main procedure. And oftentimes they'll do the closure. So after the main or the lead surgeon has done the important stuff, the resident, the fellow, or the junior physician will do the closure. And so we see somebody come to the door. Dr. Strange recognizes that. His assistant sees that he needs to step out. So the assistant offers to close the case up because, you know, Dr. Strange has done the important stuff. And so closure is generally, that's less important than the major operative goal of the procedure. So he's able to step out while his team closes the patient up. Okay, now we gotta stop. Dr. Strange has gone on to a separate procedure, and we have a patient here who has a bullet which is lodged somewhere in their spine. And because of this bullet, and because of the toxicity of the lead that is leaching out from that bullet, they've started to have some kind of neurologic emergency. And so this patient, if they didn't have the bullet extracted, would die, or at least that's the situation that is being presented here. In the surgical suite, both Dr. Strange and his assistant, which I think in the movie, if I remember correctly, this was his girlfriend, they're already starting to do a surgical procedure, and neither of them are wearing masks. There are some times when we may do a minor procedure which requires us to, you know, make an incision or do something where there's an open wound. Even in those situations, we're gonna wear a mask. And so here, they've started to do something. He actually has a burr in which he is going to drill a burr hole into the skull. I think he has no mask on. So that's bad for so many reasons. From the viewpoint of the patient, it's bad because any of the air that is being expelled out of his nose or his mouth could go into the operative field, and that could potentially infect the patient. If he were to sneeze or cough, that would be a disaster. But it's also bad from the viewpoint of the physician because when we're doing surgery and we're operating, we're using power tools, we're using burrs, drills, saws, and blood is splashing and flashing up all over the place. When I do surgery, I'm an orthopedic surgeon, I'm operating on hips, knees, and whatever, and especially if I'm doing joint replacements, if I don't come out of the operating room and I have blood on my mask or on my face somewhere, that's unusual. So because he's using a very high-speed burr and drill here, I would expect that he would be wearing a mask because this would protect at least his mouth and nose from the splatter that was associated with those tools and with the procedure that we're doing. We're typically going to be wearing eye protection as well because we don't want to get blood in our eyes or little pieces of bone. If a little piece of bone broke off while we were drilling or burring, we would not want to get that into our eye. And this is especially true when he is using a high-speed burr such as that.
We don't have time for that.
And you can see right here that the scrub nurse who is in during this procedure, she is wearing a mask. But yet neither Dr. Strange, his girlfriend, or the other physician who's standing on the sideline, none of them are wearing masks. And anytime you step into the operating room suite or the operating suite or the operating room, everybody is wearing masks. As soon as the instruments have been opened, there are sterile instruments that are present, everybody is wearing a mask all the time. Like there are no exceptions to that rule.
We don't have time for that.
You can't do it freehand.
I can and I will.
This isn't a time for showing off, Strange.
How about 10 minutes ago when you called the wrong time of death?
they're saying to him that he cannot do this procedure freehand. And so what I think they're referring to here, the bullet is lodged somewhere in the cranium. Normally, this is the kind of thing where you would use fluoroscopy, which is a type of X-ray machine. You would use fluoroscopy to localize that bullet to guide your path, because as you know, the brain is just a big hunk of electrified jello, and it is very sensitive. It does not like to be touched.
Don't touch me, I'm sterile.
And it does not like to, be penetrated by surgical instruments.
Well, I guess you're the brains of this operation.
You really want to minimize the exposure of the brain tissue to damage. You would normally localize the foreign body by X-ray, and then you would go directly to it under fluoroscopy so that you made sure that you were only damaging tissue, the minimal amount of tissue necessary, and then you would take it out. But in this case, for whatever reason, he's not able to do that, and so he is deciding to do this freehand, without fluoro and without any kind of guidance.
You can't do it freehand.
I can and I will.
Sometimes you need to do it, but generally speaking, you would want the assistance of fluoro or the robot. So here they've actually now gone into the suite with the fluoro machine, and you can see here now they're going to use X-ray to help localize. So I guess his assistant and his colleague have won out, and he's decided to use the fluoroscopy to help triangulate where it is that he needs to go in the brain.
Cranial nerves intact.
And we can see here that he's wearing special kind of glasses which are called loupes. And these are glasses which are basically magnifying glasses or telescopic lenses which go onto your regular glasses, and they allow you to see very, very fine detail. So you'll see that neurosurgeons, plastic surgeons, or anybody that has to do very, very fine microscopic work, they'll wear these glasses. An alternative to this is to use a surgical microscope, but that's very bulky, and not all the hospitals will have that kind of infrastructure or that equipment because it's very expensive. And you can see here that he's going in under fluoro.
Dr. West, cover your watch.
And I like this part. So we can see the fluoro screen in the background. And this is showing his path that he is taking with the instrument that he's using. Here we have a pair of arthroscopic forceps. And so he's going in to grab the tissue. And he's doing this without looking at the fluoroscopy screen. So everybody around can see what he's doing, but only he can see the operative field himself. But this is a part of the procedure where the utmost concentration is required. And so there is no music, there is no anything, everything needs to be silent. And because he is concentrating so hard, the actual ticking of his colleague's watch in the background is disturbing him. So he asks him to cover the watch so that he doesn't hear the ticking, so that he can put 100% of his concentration into the task at hand, which is the freehand retrieval of the bullet out of the brain in this patient. And I know for myself, even though there are times when there's music playing in the OR, people are talking in the OR, there are times when things are not going exactly as I planned, or it's a very difficult part of the case. And those are times when I will ask everybody in the room to please be quiet.
So I want to share a little story with you all about the first time a doctor yelled at me.
And if people are not quiet enough, then I will tell everybody in the room to shut the hell up.
You know, he must just be having a bad day.
So that I can concentrate all of my focus on what I'm doing. Of course, this is the moment of high drama when he is the most deep into the cerebral tissue, And of course, he is right at the base of the brain by the brainstem. And of course, because he's Dr. Strange, my man successfully gets the bullet without damaging any other tissue. Well done. Remember to join me at my online gym, Human 2.0 Fitness, for free right here on YouTube, where we help you prevent injury and move better. As always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.